Well, good morning or good afternoon. We're just on the break here, but good day to everybody, and thank you for showing up today. This is an exciting day, not only for Neepawa area residents, but for a whole region. And I welcome you all here for this great announcement. And before we start, I want to acknowledge that we are on Treaty 2 territory and the homeland of the Red River Métis. And we acknowledge that Manitoba is located in this territory. We also acknowledge that northern Manitoba includes lands that were and are the ancestral lands of the Inuit. So I'm Eileen Clark, as I think almost everybody here probably knows, the Agassiz MLA and Minister of Municipal Relations for the province of Manitoba. And I'm really pleased to be joined today by my colleague from our legislature, a very hard-working minister. I don't know how she does what she does, and I don't know how she handles all the pressure and stress, but she does it, and she does it with class, and she does it with integrity. Minister of Health, Audrey Gordon. Also joining us today, Brand Schoenbart, CEO of Prairie Mountain Health, welcome, and a doctor that I have very much admiration for. She actually saved my dad's life a few years ago, and she will always be tops in my books. Dr. Nichelle Desolé from the Neepawa Physicians Group. Also a very hearty welcome to Dr. Maron Borelli, the Medical Director for the Manitoba Renal Program, and I thank all of you for being here today. You all play a very significant role in what's happening in Neepawa. At this time, I want to invite Minister Audrey Gordon to the podium.
Good afternoon, and thank you all for coming today, all our distinguished guests, and thank you, Minister Clark, for your introduction. I would like to take this opportunity, first and foremost, to thank all our healthcare providers and staff across the province, including those in this community at the Neepawa Health Centre. They continue to work tirelessly for the health of all Manitobans. And I'm excited to be here for this announcement that I'm sure will improve quality of care for all Manitobans, not only now, but well into the future. Our government is building a stronger healthcare system for all Manitobans and investing in new hospitals serving residents in Neepawa and surrounding communities. This new facility, and you can see the visual of it just behind me on your right here, will serve residents in Neepawa and surrounding communities and will improve access to a wider variety of specialty services. The site has been selected, and Neepawa's new health centre will be built on this land behind me here, nearly 40 acres of farmland on the town's east side. Preparations for construction on the property is slated to begin in 2 weeks. This new facility will be nearly 4 times the physical size of the existing Neepawa Health Centre and will include 63 acute care inpatient beds, which is up from the 38 at the current site. An expanded emergency department, enhanced space for a number of programs such as surgery, diagnostics, and palliative care, as well as various outpatient services, including chemotherapy and ambulatory care services. Additionally, renal services will be established in the community for the first time at the new site to bring care closer to home for hemodialysis patients living in surrounding areas, reducing the amount of travel required for treatment. When it's complete, this investment for a new hospital will serve as a foundation for a healthcare system that allows residents in this region to more easily access specialized healthcare services closer to home without the need to travel to larger centers like Brandon or Winnipeg for care. Investing in healthcare services in communities throughout Manitoba will not only improve the physical health and well-being of Manitobans, but their mental health as well. Our government's investment at the Neepawa Health Centre is an investment in the improvement of patient care for people living in the community and the Prairie Mountain Health region. By improving services in Neepawa, we're supporting the delivery of more healthcare services that are more convenient for patients living in the area. This announcement today is part of a Manitoba Clinical Preventative Services Plan, which I've talked many times about. Our government has invested $812 million into the Clinical Preventative and Services Plan, which will lead to over 30 initiatives being rolled out over the next few months. And it was developed and led by clinical leaders and health system experts from across the province. Detailed planning looked at population growth and community health needs, distance to specialized health services, and the stability and reliability of the province's health workforce. So again, I'm extremely happy to be a part of this exciting time for the Neepawa Health Centre, for this community, and the surrounding communities as well. Thank you again for joining us today.
Thank you, Minister Gordon, and it has taken a lot of effort and a lot of time by a lot of individuals to get to this day. I think back to when I saw it in Treasury Board for the first time, and I think that was back in 2017, probably. It was a big issue when I was being nominated in 2015. So Neepawa people have been working on this for a very, very long time. Good thing they're so dedicated, because it's been a long journey. But we have to thank also people like Brian from Prairie Mountain Health on the other side, the people that we don't see in the community every day that have also been working with this. It takes a great team from many different places in healthcare to get to a day like this. And I thank you all and appreciate all the work that you have done, and nobody has given up. And even more recently, when the costs are escalating and escalating, I will say I was getting a little nervous because, you know, will these projects still proceed? Not all make it past that finish line, but we're there. And Brian, I would welcome you to the podium.
Well, good afternoon, everyone, and thank you, Madam Clerk and Minister Gordon. Thank you for being here. Dr. Desilets, Dr. Varelli, all our distinguished guests. I'm delighted to be back in Neepawa, and I guess just further to what Minister Clark was saying, I want to call out one individual from our team that's worked very hard on this, and that's Debbie Poole. Give a wave, Debbie. She's in charge of clinical and preventative services planning for our region, and she has worked tirelessly on this particular project and all our projects. So thank you, Debbie, for being behind the scenes and yet instrumental in making this day happen. So along with our health stakeholders and partners, we recognize that Neepawa Health Centre continues to play a pivotal role in providing essential services to our patients, clients, and residents in this part of the health region. On all my visits to Neepawa, I am always struck by the amount of new building that's happening. We are seeing something on the west side of town. I think there's a new RCMP building, the new Kinsman Courts Assisted Living Facility, and so on and so on. High Life is going strong, and it's about to get a little busier. Neepawa and surrounding area is growing. The new health center, with much expanded physical space, as was mentioned, will allow for those services to grow alongside the population in this part of the region. So we've heard from the Minister about the expansion of beds and other important program enhancements, but I really want to just highlight, I guess, the expansion of dialysis to this part of the region. Dialysis services are not only going to be added here, but it'll increase the capacity for the whole region. So Dr. Varelli, of course, will expand on that a little bit, but we really appreciate that we are looking at all the needs throughout and being appropriately placed throughout the region. So thank you for that. I want to acknowledge too that this area is greatly served by an excellent group of physicians with a range of skills, which is very valuable to this area. Over time, and together with the support of all of our stakeholders, the community has really been able to build up an excellent complement of physicians for this part of the region. Obviously, we need more physicians, like we all do, but we're committed to making that future recruitment a priority for our region. And certainly our health services could not function without the tremendous healthcare staff in all areas. Our dedicated staff continue to answer the call during these extremely busy and challenging times. Again, thank you to all of our staff, and a thank you from all of us. In closing, we are very much looking forward to being part of all the next steps in this exciting project as it comes to fruition over the next couple of years. Thank you so much.
Thank you, Brian. And he's so right when he talks about our appreciation for our physicians and all healthcare workers. My mom spent some time in the Neepawa Hospital over this last year, and with her needing to use a walker and that, it really makes you realize the tiny, tiny rooms and the tiny, tiny washrooms, the tiny, tiny doors. And I know for the physicians who are doing a lot of ER work, because there's been additional pressure put on them. And, you know, in the Neepawa Hospital, that's what, 1 or 2 little rooms. So they really make do, and we have to really extend a big thank you and a lot of appreciation to all healthcare workers in this area, because they continue to serve our needs whenever we need it, and that really is what most people want. So, Dr. Desilets, I invite you to the podium.
Thank you, Minister Clark. My name is Dr. Nichelle Desilets, and I've been working in Neepawa for just over 7 years. When I moved here in 2015, one of my very most senior and respected colleagues told me that we might get a hospital in about 10 years. Finally, we're here. Thanks for the invitation today. Working in healthcare is not an easy job nowadays, but seeing the provincial government, the health region, and our local and municipal leaders commit to improvements in healthcare for rural Manitobans is the kind of encouraging beacon that we need. I'd like to thank Minister Gordon, Mr. Schoenbart, and the health region for coming to Neepawa today for the announcement of the site of our future hospital. On behalf of my colleagues, I'd like to thank the hospital planning committees for involving us in the new designs for this facility. It's been meaningful to be asked for our opinions and our expertise, knowing that we'll be working in this building every day. Healthcare service delivery depends on material resources, but it also depends on people. We have a dedicated and determined team working at the Neepawa Hospital, and I'm very grateful for all of these people that commit to serving our community and the surrounding areas. Soon, we'll have a new facility that matches the talent and the forward-thinking people who are going to work inside that building. With an expanded emergency room, more inpatient beds, modernized obstetrical services, an expanded chemotherapy unit, and a new dialysis unit, we'll be able to continue caring for our patients and for our neighbors close to home. Thank you.
Thank you, Dr. Desilets, and please take back our sincere appreciation to all your team, because without you, we wouldn't need this gorgeous hospital that we're looking at here. So, Dr. Varelli, I invite you to come forward.
Good afternoon, everyone. Thank you for having me here. It's really a great honor and privilege. Every time I get a chance to get outside of the city, I'm unfortunately a city boy, I understand what the challenges are for folks who live out here, particularly if you have medical problems. And being on dialysis is certainly a huge medical problem. It's a burden of illness which I wouldn't wish upon anyone, but unfortunately it is here, and it is growing. It's a growing need across this province. We unfortunately have the statistic of being a leading province in the need for dialysis services and kidney failure. And that's due to, chronic diseases, diabetes, and all those things that unfortunately contribute to that. There's an increasing need for dialysis services, and there's an increasing need to bring those services closer to home. So this is a very, very nice moment. This is a good day for hearing about the fact that you'll be getting a wonderful new facility, and with that, dialysis services. We truly strive to bring services close to home as a renal program, and within the clinical preventative services plan from the province. And closer to home means as close to home as possible. So if people can be in their own home, that's wonderful. If they can have a transplant, which would be the first and foremost thing that we would do if we could, that would be even better. But if we can't do that, if we have to have what we call in-center dialysis, then as close to home is great. Like I said earlier, every time I come out here, I see how vast and beautiful this land is, and how difficult it might be to travel an hour or two from place to place to try to access the care that one needs. And it's wonderful that now approximately 28 patients who already are in the catchment who access those services elsewhere might well be able to access them here locally within their own environment. As you've already heard, this has been a major effort for many stakeholders, and I'm so grateful for all those very hardworking people. I'd like to thank you all, and particularly the people of the place who've advocated for this and who've worked so hard alongside all the other people who've put their efforts into this. I just want to say thank you, because at the end of the day, we're talking about patient care, and that's where we're centered. That's where we want things to be, and again, as close to home as possible. I'd like to thank you all again, and wish you a good day. Thank you.
Thank you, Dr. Varelli, and we really appreciate people coming out from the city and see how good things are out here in the country. We love where we are, and we like to share it. So, well, as municipal minister, I think it would not be appropriate if I didn't acknowledge our mayors, reeves, and council members, and definitely CAO Colleen, those that are here, and those that aren't, for all their work on this project, as well as others that really are making our rural communities grow and encouraging people to come here. Because without all the other projects that happen, I know when we had doctors coming to Gladstone, if we didn't have appropriate daycares, appropriate education, they couldn't come, they wouldn't come. And I think Neepawa itself has done an outstanding job of being prepared and ready for people coming. 63 beds and all these more services. We are going to definitely need more professional healthcare people, and I will be working with Minister Gordon as long as I'm there to ensure that we get people trained, that we get the nurses we need, we have the physicians we need, and we get the people in place, and that but we've got to have communities where they feel welcome and they can get all the other services that they need. And when I talk about the municipal councils, I think today of Councillor Arnis Zuski from Rosedale that passed away just recently, and I know how dedicated he was, along with other mayors, reeves, and councillors, to upgrade the medical clinic, Country Meadows. They have kept healthcare alive in this area, and a big thank you to all of you. We've got an upcoming election in just over a week, and that landscape's going to change a bit, but I hope the next who are elected realize how very, very important it is to commit to your communities and commit to the people, because we need these kinds of services and we need strong communities to build them in. So thank you, everybody. I thank my colleague Minister Gordon for coming out today. It's always a pleasure to have my colleagues come to where I work, and Brian is a great, fantastic person to work with. And as again, Dr. Desolé, the staff in Neepawa Hospital have our highest respect. And Dr. Varelli, I hope you can be back for the opening. I won't be the person at the opening, I'll be the one in the crowd, but boy, I'll tell you, a really exciting day. Thank you, everybody. And we'll take questions now for the minister or whoever.
Yeah, whenever you're ready. Go ahead.
Thanks. Given that it's almost a year now since the first announcement of the hospital, have the timelines changed regarding completion of the project?
So yes, of course they have changed slightly. So we're still, maybe Debbie can help me out here. The exact date, I'm not sure of, but as the Minister Gordon mentioned, yeah, come on, Debbie.
You can
come on.
There's lots of space.
I'll let the experts speak.
We're still working on a plan for 2025. What month in 2025, still don't know quite yet.
That's good. Thank you, Debbie.
Thank you.
I have a question, sorry if that's okay, with Miranda with the Brandon Sun. I know the province wanted extensive input from people in Neepawa to know, what is needed to support the hospital as far as infrastructure and things like that go. And I guess I'm just wondering what you're hearing from the people who live here.
So maybe Debbie can help me out there too, but I know there have been focus groups that have been involved. Also, we have worked closely with the staff in particular and the physicians. So we have tried to do as much engagement as we can. However, I want to say that we are still going to be doing some further engagement. That piece is not over yet. And so even though you're seeing a rendering here, it can still change slightly, especially within inside. So it's actually quite straightforward in terms of what now is expected to be. If you decide on the services that are going to be offered, then the amount of space is basically based on formula. But in saying that, there's still, based on the land, the specific needs or wants of the staff and physicians, it can change slightly. So obviously there's still some room for change.
Thank you.
Owen Devereaux with the Neepawa Banner and Press. Locally, there have been a few people who have been curious about accesses into the new facility. How exactly, with the construction of the facility here, will the access be available for them? Will it be just one central, or will there be multiple access routes?
I think there'll be one main access route off the highway, if I'm not mistaken. But I know even that there's still. Am I right? But I do know too that I don't think everything is written in stone on that either. But we'll be doing that very quickly over the next little while. But we're actually in the throes of that final planning, and it's really up to the town as well in their town planning design.
One more here.
Thanks. Given the need for staffing the hospital, are there any plans in the works for more training facilities within Neepawa or the immediate area?
Yes, actually, we are working on trying to have a LPN intake starting the next fall. So that should align quite well with the opening. So also, there are many provincial initiatives that have been started as well. All of them will be important to attract the staff that are needed. And I just want to say that if we cannot have the full 63 beds open on the day of opening, the expectation is at least we can build towards that immediately following. So we do know that we have lesser beds than that now, so it will be an opportunity to expand as available as the staff are available.
Thank you.
All right, thank you very much, folks.